All right, today we're jumping into a really fascinating condition that all starts the very moment a baby is born. It's all about a tiny, super important blood vessel that sometimes, well, it just misses its cue to close. We're talking about patent ductus arteriosus.
So let's start with a question. Imagine you've got this crucial piece of plumbing absolutely vital for a baby's survival inside the womb, and it has one job after birth: shut down. But what if it just doesn't get the memo? What happens if that little doorway just stays open?
Well, that's exactly what patent ductus arteriosus, or PDA for short, is all about. It's when this fetal blood vessel, the ductus arteriosus, stays patent, and patent is just a medical way of saying it remains open. This creates a kind of detour for blood that can change everything.
So, to really get what's going on here, we first need to understand the basics of this opening that, for whatever reason, decides not to close. But here's the interesting part. Before we can really talk about why this open vessel is a problem, we have to appreciate why it was such a brilliant solution to begin with. So let's rewind the clock to before birth and check out its original job as the fetal bypass.
See, when a baby is in the womb, it's not breathing air, right? It gets all of its oxygen from the placenta. So the lungs are just hanging out, not really doing anything. The body has this incredibly clever shortcut, the ductus arteriosus, which works like a highway bypass, routing blood away from those unused lungs and straight out to the rest of the body. It is absolutely essential for survival in the womb.
But then comes the big moment, birth. That first breath of air changes the whole game. The lungs inflate, oxygen floods the system, and this is where our incredibly helpful bypass has to make a critical transition. This is the moment it can go from a helper to a hindrance.
And here you can see the two paths everything can take. In a normal newborn, that first rush of oxygen is the signal. It tells the ductus arteriosus to squeeze shut, and within a few days, it closes for good. The bypass is officially out of commission. But in a baby with PDA, that signal either doesn't work or isn't strong enough, and so the vessel just stays wide open, leaving a connection between two major arteries that really shouldn't be there anymore.
So, what's the big deal if this little detour stays open? Well, let's dive into the consequences of this abnormal blood flow.
Okay, it all comes down to simple physics, really. After birth, the pressure in the aorta, that's the main artery sending blood to the body, is way higher than the pressure in the pulmonary artery, which sends blood to the lungs. So, with that PDA connection still open, blood does what it always does. It takes the path of least resistance. It flows backward from the high-pressure aorta right into the lower-pressure pulmonary artery. And the result? The lungs get totally flooded with extra blood they're just not built to handle.
Now, this extra workload on the heart and lungs starts to show up as some pretty clear symptoms, especially if the PDA is a larger one. You might see a baby breathing really fast to try and keep up. They can get tired out just from feeding, which leads to poor weight gain, or what doctors sometimes call failure to thrive. And with all that extra fluid hanging around the lungs, it's no surprise they can get more respiratory infections.
But there's one really classic telltale sign that a doctor can often hear just by using a stethoscope. It's a very unique heart murmur, and it's described with this perfect phrase, a continuous machinery murmur. It's this constant humming, whooshing sound of turbulent blood flowing nonstop through that open ductus.
All right, so we know what it is and what it causes. The next obvious question is, how do you find it? And more importantly, how do you fix it? So let's talk about diagnosis and modern treatment.
The definitive gold standard test for a PDA is an echocardiogram. It's basically just an ultrasound of the heart, totally painless and non-invasive. Using sound waves, doctors can get a live video of the heart. They can literally see the open ductus and even use color to watch that abnormal jet of blood shooting from the aorta back into the pulmonary artery. You can't get much more precise than that.
And the best news of all is that PDA is a very treatable condition. For premature babies, who are the most likely to have this, sometimes all it takes is a course of medication, like indomethacin or even ibuprofen, to encourage that vessel to finally close up. For older kids, there's this amazing, minimally invasive procedure where they can thread a tiny catheter up through a blood vessel in the leg all the way to the heart and deploy a tiny device, kind of like a plug, to block the hole.
But now, get ready for this, because this is where the story completely flips on its head. In some babies born with other, much more complicated heart defects, that open ductus is actually a lifeline. It might be the only way for blood to get where it needs to go. In those cases, doctors will actually give a medication called prostaglandin E1 for the sole purpose of forcing the ductus to stay open, buying them critical time until a bigger surgery can be done. Isn't that wild?
So let's do a super quick recap. PDA is a fetal blood vessel that just sticks around after birth. It causes a left-to-right shunt, which overloads the lungs. The classic sign is that machinery murmur. And most importantly, it is a highly treatable condition with fantastic outcomes. And that leaves us with one final, kind of mind-bending thought. We just saw how a structure that's supposed to close can cause problems, but in a different context, keeping it open can actually be a life-saving move. It really makes you wonder, doesn't it? What other so-called mistakes or leftovers in our own biology are just sitting there, holding some hidden, untapped potential?